pronouns.
This meeting is being recorded.
So once more, I'm glad to introduce Linus using they, them pronouns. They're a young caregiver and a returning speaker with a brilliant mind and wonderful thoughts to share with us all. So as soon as you're comfortable, Linus, I give the stage to you.
Thank you very much. Hello everybody, my name is Linus. I'm 13 and a young caregiver. I love all sorts of things, from chess to Rubik's Cubes, board games, and languages. I care for my two brothers, my mom, and my dad. I have 4 cats, one more since last event, and I foster kittens. My favorite color is purple, and in my free time, you can find me with my books and my cats. I've been young care ever since I can remember. Between my 2 brothers, I'm the middle child. How I help them looks a little different for each of them. I support them both with anxiety. They can both get stressed with certain things that might not cause other people to get anxious. It can start very small and build. I do a lot of different things to help them and help keep them calm. For my one brother, he likes to do things with another person, and that can be me. For my other brother, I act really silly to make him laugh. I'll even act like a raptor because he loves Jurassic Park. It always makes him laugh. I often have to keep my brothers from fighting, and I can spend a lot of my time helping them stay happy. Some other ways I help out around the home and help my parents by doing different chores around the house. That looks like helping change my mama's bed, picking up things for them at the store. When they're busy with other stuff, I'll do other chores. Sometimes I'll go to appointments with my parents or siblings. That could be the dentist or other appointments. As young carer, I often don't even notice my caregiving tasks. It feels so normal. They're just a part of my day. I'm almost always caregiving, but I can do other things while I'm caregiving, and so don't really notice. One thing I love about being young carer is I love being helpful. When you're helpful, someone notices, it feels good. Even if they don't notice in the moment, they might later, and that's still really nice. Like at the end of the day, they might say, thanks for helping, and I love that. You can also give this level of trust that's like the next level. They know they can count on you, and that you can count on them. I feel really close to my family because of it. One of the hardest things for me as a young carer is when someone in my family is sad or having a hard time, and they don't want help. If my brother is sad or having a bad day and there's nothing I can do to help, it hurts me to watch them hurt. It can be difficult to watch other family members too when you know there's nothing you can do to help. I also worry about them if I'm not around or busy. Being a young carer can sometimes be frustrating. If I'm already doing something, someone asks for help, and I stop what I'm doing, I'm happy to help, but on the other hand, I'm also a little bit frustrated. Like if we're choosing a movie, it's sometimes easier just to go with the flow. But if I do, I don't get to watch the movie that I would have picked. I'm still happy to watch the movie and enjoy it, but then on the other hand, sometimes being a young carer, you give a little too much and it can take away from what you have. One of the more challenging times for young caring was the past couple of years with COVID-19. Some things were for my family that were not for other people. I'm homeschooled, so I spend a lot of my time pretty close to my family. We've already spent a lot of time together. I live with 2 and so we had to be extra careful. There were times when they would start to ease off restrictions, but we would stick with the stricter protocols. We just had to be careful the whole time. I found I was worried more about my family than probably lots of other kids my age. We're now starting to ease up a bit, but still careful. Something I wish other people knew about young carers is how much they know about how to support the person or people they care for. They're very good at supporting their family members and know a lot. Young carers can feel shrugged off by people in the community, but they know what they're talking about. I want people to know that they should listen. We can do things that might seem like too much, but we have done them, can do them, and want to help. There's some people who think kids shouldn't be young carers, but I say that not being allowed to help is so much worse. I want people to know that young carers are normal kids, but also not normal. They might know more about certain things than other kids. For instance, I have given IV medication. Young carers face a lot of unique challenges, and they might be more mature. I've noticed that when I first meet another kid, we're just two kids, but then their home troubles are not my home troubles. My worries can be different than other non-young carers. If I'm dealing with level 5 worries and they're dealing with level 3, when I'm used to level 5 and they may be used to level 3, we're both maybe worrying the same amount about our worries, even though they're on different levels. My biggest wish for young carers is for other people to know that we are here. We need to get more support and to be listened to. I also hope young carers can find a program or time to take a break, because that is what they need. I want all young carers to be noticed, to get the support they need, and to be understood. Thank you so much for coming out today and taking the time to listen to me and learn about young carers.
Thank you so much for speaking, Linus. Moving on, we have yet another wonderful person to speak with us today. I'd love to introduce you to Uroba, using the pronouns she, her. She's a new speaker to our event, but she's also a wonderful young caregiver. She's 19 years old with so much experience and memories, and cares for her siblings and families. So, Uroba, I'd be happy to give the stage to you now.
Hi there. Thank you for the introduction. So my name is Aruba Sayida. I am 19 years old and I have been part of the Young Caregivers Association since 2012. I would like to start off by saying that I am a young caregiver for my younger brother who was diagnosed with autism when I was in grade 4. So I was 12 and he was, I was like about 12 when he was diagnosed. So when he first got diagnosed, in my family and in my extended family, none of us have ever seen autism or any sorts of disabilities. So we were quite shocked, and it kind of confused my parents just because we've never seen it and we've never been around it. So this like took a toll on my parents' mental health for sure. And ever since I was younger, I decided that I shouldn't be a burden to anybody. I should kind of start taking things on my own, and I shouldn't like pressurize my parents because I knew how much they had going on their plate when it came to my younger brother. I just didn't want to be like a part of that. And I started like this like guilty phase. Like I remember when I was in grade 5, it's like super young, like it's super normal for like kids to pick on other kids. I was getting like bullied pretty badly in grade 5, but I never went to my mom about it. My mom did end up finding out about it, but like I never went to her about it because I started like this guilty phase where I was like, I can't go. She already has so much on her plate. So when I was actually, I didn't even realize I was actually having this guilty phase until this year when I was at a youth advisory committee meeting, actually for like this program, and some people brought it up how they felt guilty growing up, and then I was like, oh, I've kind of been through the same. So that's actually when I realized it, and I am 19 now, so that's pretty crazy. But nonetheless, while growing up, I also never really realized the responsibilities I had. I always saw them as normal. So I was constantly monitoring my little brother. It just came to me. It's not like I was expected to do it, or like, I mean, I was kind of expected to do it, but it's not like I recognized that I was expected to do it. It just kind of came to me, and I had to like monitor him. Whether it came to like him sleeping or eating, or even like at something so small like grocery stores. I remember he had this phase where he would be screaming and making sounds, and everyone around me would be like staring at my family, and it would make me so uncomfortable and anxious, but I kind of just had to like accept it and move on. I remember when the principal at my school would call down my mom to pick up my little brother when he was like being hard to handle. And I remember when I would be walking down the hallway with my friends and my principal would tell me about it, which like in front of my friends. And I remember that made me feel so like I can't even to this day describe the feeling, because I was like, that's my little brother. Like, why are you coming up to me at my spare time and talking to me about this? So it honestly gave me a lot of anxiety growing up. And even to this day, like, if my little brother has a bad day or if I hear something happen to him, it really makes me anxious for the rest of the day. And honestly, before finding out that my little brother was before finding out my little brother had autism, before he was diagnosed, I have experienced my life both ways, like before I knew I was a young caregiver and after I knew I was a young caregiver. So before I knew I was a young caregiver, it was really different. I remember I was so spoiled as a child. Like if I wanted something, I almost always got it from my parents, or like, but like after I became a young caregiver, things changed. So I experienced like both sides of it. Um, and everything seemed to like, I remember when before I knew I was a young caregiver, it was like everything seemed lighter in my family. It wasn't like nothing was like super deep, like everybody didn't have like that type of stress on them. So that changed a lot. And even like when I was younger and I was like 12, I like felt that in my day-to-day life, especially since my parents would be talking about things right in front of me. So it really did take a toll on my mental health for sure. Even going to school as a young caregiver was pretty difficult. Like I'm someone who really strives off of like academic validation. And so when I was like starting to lose that in my life, it like makes me feel really lost. And I remember that when I was in grade 10, I was really struggling balancing my responsibilities at school, at home, and being with my friends, and also finding like time for myself to do things I enjoyed. I had nights in high school when I was 15 years old and I was going to bed at 4 a.m. in the morning just so I could like finish my homework or like study for a test. And I was completely losing all of my motivation because my grades were dropping. And I hated that, and I was like really like starting to lose motivation. It really made me just like not want to even try, just because I come from a family where like my entire family values academics like pretty greatly, and my parents have always like worked their hardest to make sure that I succeed at school. And because I felt like I wasn't succeeding in school, it made me really feel like I was letting them down. And it was hard for me. I didn't want to go up to my teachers and ask them for extensions or ask them for extra help because I didn't see other kids doing it. So I thought, like, the way I thought when I was growing up was that I'm not special enough to like ask for that because everybody has like their own problems in life. So I never even thought about asking it because I just didn't think it was like normal to ask. So there was a lot of difficulties I had growing up that I'm now realizing at 19 years old. But aside from the difficulties, I had learned a lot from being a young caregiver. I definitely think it has shaped me to be the person I am today. I feel like all young caregivers have different stories, but one thing is the same. We're all selfless, and even though we have a hard time putting our needs first, it makes us who we are. Some of my best traits have come from me being a young caregiver. Like I definitely have skills that I feel like other kids didn't have. When I was younger, even, it was common to make jokes about disabilities, and I never did that because I knew better. And then even when I was younger, there was like certain things that I know like the person that was speaking before me has mentioned some of the things that when I was listening, I was like, damn, like I can definitely relate to this. Like I've grown up with some of the same challenges, but aside from those, I've also learned how to be compassionate, generous, and I learned a lot of family values, which definitely like shaped how I turned out today. So without my brother, I genuinely believe I wouldn't be as strong or confident as I am today. I definitely wouldn't be presented with opportunities to grow and mature the way that I did now, which I'm really happy about. I love the way I've turned out as a person. I wouldn't have it any other way. And honestly, like my little brother is to thank for that because he does make me who I am. It's like part of my identity. So I have so much love and compassion for my little brother, any person with disabilities, as well as any other young caregivers. It is really stressful to grow up around the challenges that young caregivers have to face. And oftentimes they don't realize what they're going through is valid, because I know I definitely didn't. And I talked to other young caregivers who definitely don't think that their challenges were valid as well. I feel like all young caregivers have different stories, but they're all the same because we all understand each other. And we all understand that we go through these challenges. so when I was younger, I've mentioned this a few times, but I didn't realize why I was really part of like the Young Caregivers Association, just because it felt normal to me to be like the way that I am. But by going to Powerhouse, which it was called at the time, I was able to actually learn more about myself, my family, and I met other kids who understood the challenges that I go through, even if they had like different things that they were doing, but they kind of understood. Like it was like, and that was really nice for me. Whenever like I meet new people, even to this day, like I am pretty extroverted, so whenever I meet new people, I won't talk about like I don't discuss like my family life because that's super personal to me. But whenever I meet someone whenever I met someone even growing up and to this day, like it's a part of Powerhouse or they're like a new member and they join, I'm always able to talk about my family and myself a little bit better because I feel like that's like one side I always like keep to myself. But whenever I'm around them, I'm able to express that side a lot better just because I know they can relate. And I'm very grateful for that because if I wasn't a part of this program growing up, I wouldn't have been able to be presented with those people. The staff also really, really helped me out. Like even from when I was growing up, I've gotten to so many helpful programs that taught me valuable skills. Like I remember there was a cooking workshop I went to. There was also programs where I just kind of got to be out of the house in a safe environment where people understood me and I kind of just took a break. I also got the chance to grow my leadership skills as well as my confidence by being the part of like the youth advisory committee here and getting the opportunities to speak up about my experience like I am today. So I'm so grateful to be part of this program just because I have always felt super supported by the wonderful staff and my peers. I remember there was also a time where I needed help like registering for university because I was stressing out and I literally got one-on-one help here. Like I think that this program has really helped me like be the person I am today as well. They've always been here to support me and I am very grateful for that. I'm very grateful for all the young caregivers that I have met here and I'm very grateful for the staff and just because I always feel very safe and supported. Thank you.
Thank you, Aruba. And again, thank you, Linus. Now we'll move on to someone from the Young Caregivers Association, just to talk a little bit more about their experiences working with these wonderful individuals, as well as their perspective, also bridging the gap between this population and healthcare professionals.
Thanks, Marianne. So my name is Michelle Lewis and I'm here with Aruba and I'm the Executive Director of Young Caregivers Association. And we are in Ontario, located in Southern Ontario in the Niagara, Hamilton, Brantford, Halton, Norfolk area. And can I share my screen, please?
Yes, one moment, I'll give you access.
Thank you. Sorry, I didn't have my slides submitted in time. Thank you so much. So I'll just talk a little bit about us as an organization really quickly and what our interactions with healthcare professionals have been like since our existence and where we're headed in that direction. So we were established in 2003, and it was really because of the work of the Alzheimer's Society here in Niagara, of case managers going to people's homes, recognizing that there were children and youth helping provide care for family members with dementia. And those kids spoke of the stressors of that role and were in definite need of additional support. So those people gathered other agencies together, started talking about kids who were helping provide care, realized that in Europe they were called young carers, and started some programming through creating our organization at the time. So that's just a little bit about us. There's more about us on our website if you're interested. So where we're at is our vision is a Canada where young caregivers and their families are recognized, supported, and empowered. And I heard those words mentioned already tonight. And those are just really the key things to focus on. And I heard the two young caregivers speak about that recognition and about that support, and then feeling growing and developing and feeling empowered. So as adults and as professionals who interact with families, patients, clients, what is our role? And really what we hear from young caregivers and what we heard tonight is that we need to listen to their needs. They're the experts in their experiences. Even though they're kids, they're tuned in and they know what's happening and they're providing care at home and they want to be included. We hear that time and time again. Don't try to protect them from information. They want to be included in the discussion because they're the ones handling it at home. They want their feelings of isolation addressed, especially because of the pandemic. What we learned from our young caregivers and families during the pandemic is that feeling of isolation increased, the level of caregiving increased, the stress levels increased, especially when schools were closed and everybody was at home together and nobody was getting a break. So there's definitely the impact still lingering as a result of the pandemic here, where there were those amplified feelings of isolation and loneliness and depressive symptoms and anxiety and stress as a result of that. And identifying those who are unidentified and unsupported. So the risks lie with those kids who aren't identified. They're quietly caregiving in the background. Nobody's really recognizing them. Nobody's asking them how they're doing. They're not getting any support. And those are the ones that are at greatest risk. So this is Hannah. And Hannah has been in our program since she was 9 years old, and now she's a young adult. And Hannah has that time of going through childhood, adolescence, young adulthood now, where she's in a very reflective place, where she reflects back on her experience as a young caregiver for all those years. And Hannah's story is that she translates for both of her parents at medical appointments. Dad has his legs amputated because of diabetes, and mom has had a few heart attacks. And what Hannah says now as a young adult, now that she's more empowered to speak up, is as she was in her younger years and as a teenager, she felt invisible and she felt like she was just treated as the interpreter at these medical appointments. She felt excluded from conversations. Even though she was translating the information, she wasn't given really instructions or context as to what that meant for what needed to be done at home. She was just being treated as the translator. And she has been caring for her father for many years. So this is it's stories like these that motivate our organization to figure out, okay, how can we do more? How do we talk to folks who are interacting with young caregivers and help them understand what their side of the story is? But then how do we get the side of the story from the healthcare professionals as well? So in conversations with young caregivers and with professionals in healthcare, here's what we've heard. We've heard that kids aren't considered to be caregivers. They're not considered as helpers in the home when it comes to providing care. They're just overlooked because we just don't think of it. We don't think that they are caregivers. Some young caregivers keep their situation secret. My mom growing up told us, my siblings and I, don't tell anybody, because she was fearful. She was fearful of having children's aid intervention, of somebody thinking that what was happening was wrong. And so we kept it secret. So the barrier for professionals is what happens when families are just being secretive and we don't know what's happening. It could be difficult to engage with families based on their circumstances. The needs of the families sometimes only come to the forefront when they're already in crisis. And we heard a lot about the mandate, that we don't have the mandate to talk to the children, that our focus is on the client or the patient. And if I talk with that child and they tell me they're suicidal, well, then what? So I don't feel like I'm skilled or I have the confidence to actually engage with that child, because what if they disclose something to me, or what if they're really stressed or they're really struggling? What am I supposed to do? It's not my mandate. So these are very reasonable, fair concerns that we've heard from a variety of healthcare professionals. So what we're trying to do is we were able to get a large grant from Petro-Canada Caremakers Foundation, which is a new foundation dedicated to family caregivers. So our strategy is trying to build awareness. So our interactions with healthcare professionals have been limited up to now. It's just doing those initial interviews, that outreach to hear some of those stories. We hear from our young caregivers. So now what do we do with this? So what we're trying to do is take those stories. We have young caregivers who tell us of their experience in the emergency department, where they're trying to advocate for their family member because they know what's about to happen because they've seen it before, and they don't actually get taken seriously until that family member hits the floor. And then that has been a traumatic experience for them because they knew what their parent needed, and they weren't respected or acknowledged. And so it was the whole trauma of that whole experience and of feeling invisible again. Right now, we're working with Santis Health to develop a knowledge center, and it's really forming the center of excellence of all of our years of knowledge and research and experience around how to support young caregivers. And we have a focus on healthcare professionals as a target audience, of one of the target audiences for that. So what we did was interview some folks across the healthcare sector to hear, what are your challenges with identifying young caregivers and what tools would be helpful to you? So we're right now trying to develop those and just raising awareness. So we're at, sort of right at the starting phase of this, of building awareness. So events like this are so important, and we're going to have more in the future when we launch our knowledge center in the new year, to just start talking about this, hearing from each other, what are the challenges, what are the barriers, what's stopping us from identifying these kids, and what can we do more of? And as an organization, that's the direction that we're headed in. So that's it from me. Thank you very much. Our website's caregivers.ca if you want to learn more or reach out to me. Thank you.
Thank you so much, Michelle. We have some time for questions for Michelle and for both of our young caregivers. Please feel free to send those in the chat. You can either send them to me directly or openly in the chat, and we can get those answered.
Perhaps while some of you are thinking about questions to ask, I really would like to give my thanks to the young caregivers for sharing their experiences, and also to Michelle for giving us a better understanding of how we can connect as healthcare providers, or those even in our community, to understand young caregivers' role. And it's very exciting to hear that there is going to be a knowledge center that's going to be created. And it looks like we have a question now. So this is a question for Michelle. Will it just be the Young Caregivers program managing the grant, or will they also be working with the Toronto organization Young Caregivers program?
Yeah, thank you. So this grant was specific to our organization. It was an application that we submitted to start this work. So, I mean, we're always interested in the spirit of partnership and sharing and whatnot. So at the point where we get sort of the infrastructure created, and when it comes to the launching, then we'll be reaching out to other partners to certainly participate and help with that.
Okay, and we have another chat. Another question. This one is geared to the young caregivers. What is something that you would say to your younger selves who just realized that they were young caregivers? Maybe, Aruba, we can start with yourself.
That's a good question. Something that I would tell my younger self would definitely be that I am valid for my experiences, and I'm valid for asking for certain things that I don't think I deserve. Like, for example, when I talked about how I never asked my teachers for extensions or never talked about any of that just because I didn't think I was valid to do it. I would definitely tell my younger self like that I am going through struggles that other kids my age aren't going through. So it's definitely valid for me to reach out and ask for help in those scenarios. That would be mine.
Amazing. Thank you. Linus, do you have anything you'd like to add?
I have pretty much always, like, my parents have pretty much always been open about young caring. I've always had access to YCP, so there hasn't really been a time before I knew that I was a young carer that I can remember.
That makes a lot of sense. Thank you, Linus. We have a few more questions in here as well. Again, for the young caregivers. Linus, maybe you can start us off. So the question is, do you have any tips for your caregiving role being taken seriously with healthcare providers? So is there any advice you would maybe give to healthcare providers like doctors and nurses of how they can help support you in your young caregiving role and take you seriously?
Well, the first thing that comes to mind is if any sort of healthcare provider is told that, like, this kid is a young carer for me, if there is something that they could help with, offering it to them for them to do.
Amazing, thank you. Aruba, is there anything you would add to that?
Yeah, I would just like to say that if there was like a way to get rid of the stigma, just because there's a lot of stigma that kids don't know anything, or like kids don't know as well as like adults do. So oftentimes that's like the reason why a lot of kids are overlooked, is just because of all the stigma around it. So I would say probably if there is a way that they learn to actually like incorporate people in the family instead of like having that stigma around it.
Amazing, thank you so much. Are there any more questions? Feel free to, again, put those in the chat or send them directly to myself. I know some people may be having difficulty messaging the whole general chat, but you can definitely send those to myself and I can read those out loud. I'll allow a couple more minutes for anyone to send in any last minute questions. And in the meantime, I think I have a question for our young caregivers as well. Aruba, maybe we can start with you. What would you say has been the best part about being in a young caregivers program that maybe helped with something that you didn't have before?
I think that one of the best parts is definitely just having the staff there. I feel like the staff here is like so skilled. It's like anytime I'm going through a problem, I can like, whoever I like talk to, it's like they will, even if they don't go through the same experience, it's almost like they do go through the same experience just because of how they respond and like the way that they can like handle me. Like I've had a few times in the office where I've like had a breakdown and some of the staff was like able to handle me really well. And then later I was like, oh my goodness, this is amazing. As well as like, I think it would also have to be like the kids, because a lot of time young caregivers don't feel comfortable talking to other young caregivers. Young caregivers don't feel comfortable like talking to people that aren't young caregivers about like their issue, but just knowing that you're like in that like young caregiving community, I feel like it just makes it easier.
Amazing. Linus, what about yourself? What would you say is the best part about being a young caregivers program member for yourself?
I kind of agree. Like, at least the staff is very good. And being able to talk to other kids who've gone through similar experiences. But then also just having a place to go and refill it, so to say.
Amazing. And we have one final question. This is for Michelle. Michelle, what was one of your memorable moments working with young caregivers?
Oh dear. One memorable moment. I don't know if I can chalk it up to one. You know, I was a young caregiver and I didn't realize till 5 years ago, and I've been at this organization for 10 years. So I think just being with these amazing kids and hearing their stories, something resonated in me, and it made me realize that I was a young caregiver and I had no clue up until about 5 years ago. So that was a pretty memorable moment for me. Also, a moment that has stuck with me is one of our teenage boys was talking to his dad at one of our family events, and they were talking about what happens to his twin sister who has a disability to the point where she's actually in requires constant care, and she's in a residential home. And they were talking about what happens when the parents are gone and when they pass on. And you know, and that young caregiver said, "Don't worry, I will take care of her." And that hit me really hard. I actually had to excuse myself for a moment. And that's just you know, a reminder that this isn't necessarily a temporary thing. It's not a short-term thing for a lot of these kids, like Aruba, who has a sibling, like Linus, who has a sibling, that this is a part of their life. This is their life. And as they become adults, you know, some of them may take on that care for their siblings. And it's just that moment I think hit me, because it was just like that reality check that outside of these walls of our powerhouse program of YCA, when they are in their real lives, when we're not with them, we can play a huge role in supporting them and helping them to be successful, to give them all the good stuff they need. So when they are adults caring for their, sister down the road, they got a really good start. So it was just a really great reminder to me.
Thank you so much, Michelle. I know that hits home for me as well. We're running a little bit ahead of schedule, but we will be having a break upcoming. But before the break, I'm going to ask our team to talk a little bit more about the wishes and what that will look like, and then we can continue those after the break.